Hello, I'm Dr. Gil Yosipovich, the lead author of the manuscript titled Secukinumab Provides Rapid Relief from Itching and Pain in Patients with Moderate to Severe Psoriasis, Patient Symptom Diary Data from 2 Phase 3 randomized placebo-controlled clinical trials. Here you can see my disclosure information. Among patients with psoriasis, severe itching of the skin and pain are among the most troublesome symptoms of the disease. More than 75% of patients with psoriasis experience itching, and almost half experience pain. These symptoms are associated with worse disease severity, health-related quality of life, work productivity, and psychological and social well-being. Secukinumab is a fully human monoclonal antibody that selectively neutralizes IL-17A and has been shown to have long-lasting efficacy and safety in the complete spectrum of psoriasis manifestations, including itching and pain. A previous analysis of pooled data using the Psoriasis Symptom Diary, or PSD, from the Erasure and Fixture Phase 3 clinical trials showed that treatment with secukinumab resulted in significant improvements in patient-reported psoriasis-related itching, pain, and scaling symptoms at week 12 compared with placebo. In our study, patient-reported itching and pain were assessed during the first 12 weeks of treatment using the PSD. The PSD is a validated and responsive tool designed to capture the daily signs and symptoms of psoriasis reported by the patient as shown by these 16 items. This is a psoriasis-specific patient-reported outcome measure with a 24-hour recall period. 7 questions evaluate the severity of key signs and symptoms such as itching and pain, and 9 questions evaluate patient-reported annoyances related to experiences of these key signs and symptoms. Our study focuses on the 2 questions highlighted here, asking overall how severe was your psoriasis-related itching or pain over the past 24 hours. Shown on this slide is our study design. The absolute change in itching and pain scores from baseline to weeks 2, 4, and 12 were compared across the 4 groups shown here. Overall, our study will highlight the effectiveness of secukinumab in achieving rapid improvements in patient-reported itching and pain within the first 4 weeks of treatment using pooled PSD data from the randomized, double-blind, placebo-controlled Phase 3 Erasure and Fixture clinical trials. Of 2,042 total patients in our study, 820 patients, or approximately 40%, completed the PSD at baseline. Baseline demographics and disease characteristics were similar across all treatment groups and were consistent with analysis previously published from Fixture and Erasure. For this panel, patients were asked, overall, how severe was your psoriasis-related itching over the past 24 hours, and graded the severity from a scale of 0 to 10, where 0 represents no itching, and a score of 10 represents itching as bad as you can imagine. Patients treated with secukinumab demonstrated rapid improvements in itching severity from baseline as early as week 2 in both secukinumab dose groups. These were significantly greater than those with placebo and etanercept. Significantly greater improvements from baseline were also observed at weeks 4 and 12 in both secukinumab dose groups compared with placebo and etanercept. Next, patients were asked overall, how severe was your psoriasis-related pain over the past 24 hours? And similarly graded the severity from a scale of 0 to 10, where 0 represents no pain and a score of 10 corresponds to pain as bad as you can imagine. As early as week 2, we saw improvements in pain severity from baseline among patients treated with Secukinumab in both dose groups. These improvements were significantly greater than patients treated with placebo and etanercept. Similar observations were noted at weeks 4 and 12 in both Secukinumab dose groups compared with placebo and etanercept. As seen here in this figure at week 2, the proportion of patients who achieved no or minimal itching or a score of 0 or 1 was significantly higher with Secukinumab 300 milligrams than with placebo. Numerical improvements were observed with both Secukinumab doses versus etanercept. At week 4, the proportions of patients who achieved no or minimal itching were significantly greater with Secukinumab 150 and 300 milligrams than with placebo. Patients treated with Secukinumab 300 milligrams also showed significant improvements versus etanercept. At week 12, the proportion of patients who achieved no or minimal itching were significantly higher in both Secukinumab dose groups than in the etanercept and placebo groups. Similar observations were noted with PSV pain scores. The proportion of patients with scores of 0 or 1 who achieved minimal or no pain was significantly greater with Secukinumab 300 milligrams versus placebo at week 2. 2 weeks later, at week 4, the number of patients with scores of 0 or 1 was significantly greater with both Secukinumab groups compared with placebo. In addition, patients treated with Secukinumab 300 milligrams also showed significant improvements compared with those treated with etanercept. Lastly, at week 12, the proportion of patients with scores of 0 or 1 were significantly higher in both Secukinumab groups compared with the etanercept and placebo groups. We next looked at achievement of clinically meaningful improvements in itching and pain severity. At week 12, the proportion of patients who achieved greater than 5-point improvements in itching severity were higher in both Secukinumab dose groups than in the etanercept and placebo groups. Similarly, patients treated with either dose of Secukinumab were more likely to achieve 3 to 5-point improvements and greater than 5-point improvements in pain severity at week 12 than those treated with etanercept or placebo. In summary, we show that Secukinumab demonstrated significantly greater improvements from baseline in patient-reported itching and pain as early as week 2 compared with both placebo and etanercept. These improvements were sustained through the induction period at week 12. Although the PSV was completed by only approximately 40% of patients enrolled in both the fixture and AirAssure trials, their demographic and clinical characteristics were similar to those of the overall study population, and therefore our results may be applicable to a wider moderate to severe psoriasis population. Our results show that Secukinumab can provide early relief from psoriasis-related itching and pain, which may also improve overall quality of life.